Okay, so now the surgery is done. We've learned about the different options. What happens in the post-op phase, and what goes on there?
Post-operative phase, what we've gotten to is, again, first thing is stabilize the knee and minimize pain. So a lot of the athletes, there is a femoral nerve block done that then numbs up the thigh and numbs up the front of the knee. Less pain means less swelling. Okay? Also means the total accumulation of pain into the brain. If you can minimize the pain in the beginning, then the brain has less pain totally, and the pathways of pain are less. Less pain means the athlete now can get to rehab faster. So what we do is we send them to rehab quickly. At surgery, the graft is positioned. It's what we call isometric, so the knee can be brought through a full range of motion that's observed by the surgeon without making the graft too tight or too loose. So I can start motion. You want to get your motion back immediately, so therapy starts 3, 4, 5 days after surgery. They're in therapy with the therapist that they had before, a friend, and that friend starts to take care of them again. And they start to get their motion back. And we find that there's better healing with motion in the knee. So motion is first. We want to maintain full extension, get flexion, let the athlete do it, let the therapist help them along, and then shortly afterwards, as we get motion back, we start on strengthening.
I find with these patients, the first 4 to 6 weeks are relatively boring, but they're important because we want to prevent problems later on. Once you get past that 6-week point, then we really start having fun with them and we start moving. Is that correct? Is that kind of the time frame that you look at from more advanced activities?
I would say, I'm going to have to say yes again. You're a physical therapist. You're the expert in physical therapy.
From a healing standpoint.
Yeah, in the beginning, a little stiffy, a little painful. They got to get through that. But it does get a lot more fun with the different activities and all the new physical therapy training that the patient does. It's boring to sit there stretch to get your motion back, and then when you start the strengthening exercise, not a lot are done. But then you're right. I can say maybe not at 4 weeks, but at 6 weeks we start to do some different things that they begin to enjoy.
Yeah, one of the most important things is retraining the joint and teaching it how to learn again and how to respond quickly in space. We call that proprioception.
Correct.
But then we get more advanced in the process. We're going to get them back to their sport, agility and jumping and all that stuff. How important is that?
Well, again, both things. What they start doing is the two basic therapy modalities is just what you said, proprioception. It's getting the knee to start to work again to control itself. It's time and space. You're trying to hold it together, and it's the simple. I'll just very simple. As you know, it's just standing on the knee alone. Now stand on the knee with your eyes closed. Okay. Now stand on the knee with your eyes open, but on an uneven surface. Now do it with your eyes closed. Now do it on an uneven surface that starts changing, and eyes closed. These are the games that, and they see that. Next is, when you get past that, is plyometrics. Okay, and what we really want to do is we want to do we want both muscles to work at the same time, the quadriceps and the hamstrings to work together. So plyometrics is these little jumping programs. You start to jump up, but then you have to jump down. You have to jump left, right, back, front, and then you start all of these games. And what are you doing? You're working else at other times just on strength, but now you're working on function, which is the knee, and that's what protects the knee. You got to get the knee now to really work quickly to, again, another situation that might injure it.